Well, I would say that, we often see technological advances translate to healthcare and, advances in medicine. But I think now that we're really entering the age of bioengineering and synthetic biology, and we are just poised to see explosive growth, that we are going to see, technology development in this field really infiltrate so many different sectors of society, really cutting across, agriculture, advances for environmental health, reversing damage to the environment, as well as the chemical industry, the food industry, cosmetics, creating completely new classes of biomaterials. And so I think it's going to be very exciting. I think we're really entering exciting times.
Yes, I think probably doubling down on Amy's comments again. I think there is a commoditization. Us computer scientists are muscling into the medical field and applying our skills in these areas. It's much more interdisciplinary. So I think there's going to be people from different fields putting their input into the field of biotechnology, engineers, computer scientists, but also maybe philosophers, as we discussed earlier, as we start to enter ethical issues of what we can do or should we do. And I think that this has been an excellent format, this conference, to try and discuss different aspects of the biotechnology field.
Yeah, I'm going to put on my designer cap and say good design all around. And good design, as I explained earlier, is not just aesthetics, it's functionality, it's value. It's the way it impacts people in the short and long term. But in order to get there, we need to make things accessible, not only to us, accessible to others, accessible to people who have less or almost nothing. We have to make the experience so intuitive that people can have access to it without having to read something in a foreign language or something that they don't understand.
I think Mother Nature probably sees humanity as her beautiful teenage kids who are playing with firecrackers in the closet. And, I think she's so proud of us. And I think we are actually finally growing past that stage, right, where we can tend to this beautiful garden as we go and explore the cosmos, right? And, I would love to say that, Endiotics makes nanotechnology robots, right? But when you look at our giant, scary, ridiculous pill, you're thinking like, this is ridiculous, right? We kind of see it as like the Ford Model T, right? We want to demonstrate that it's possible. You don't need big capital equipment. And if the goal is nanotech, but along the way we create HIPAA compliant regulatory video calls where you can control something over the internet, share the data with the patient, not share the patient's public data in an inappropriate way.
Yes, I consider that we are living in a particular historical moment, which we never had before in our history. We are in a moment where everything is being changed. Every technology is advancing at a much faster pace than we anticipate. We will soon have a change in cars, for instance, from combustion to electrical engines. We will live with driverless car. We will live in space. We will expand for the first time out of our planet. We will have our species, which will expand out of our planet.